During this global pandemic called COVID-19, it's easy to talk about the task before us as a war we must win, when instead we need a human response, not a wartime response. Today, COVID-19, our Pearl Harbor moment. Hi, I'm Rich Harwood. This is the fourth in a series of special Harwood half hours called Turning Outward Together. They're intended to help you stay grounded during these difficult times that we're all facing day after day. Uh, if you want to see the previous episodes, you can go to our Facebook page. Up on the top, you'll see a banner. Just click it on, and you'll find a playlist of the previous episodes that I urge you to listen to, in addition to the one here today. Shoot me a message and let me know that you can hear me. And here's a question I'd love for you to think about over the next 15 or 20 minutes that we have together this afternoon. And it's this: how does talking about COVID-19 as a wartime response make you feel? How does talking about COVID-19 as a wartime response make you feel? You know, this is a topic I've wanted to talk about for a while now as I watch the news and watch our political leaders and news media talk about this pandemic. And I find myself filling with anger and rage about the language they use, the metaphors they use. The Surgeon General just this week said that this is going to be, that this week, the week that we're living through right now, that this week is going to be our Pearl Harbor moment. And when I listen to the president, when I listen to various political leaders, as I mentioned, and news media folks, they use a language of war to talk about this pandemic. They use war metaphors in terms of how they're approaching this and how we should think about it and how we should feel about what's happening around us. And, you know, I don't know about you, but we've heard wartime talk like this in the past, and it didn't help us then, and it's not going to help us moving forward into the future now. We've heard about the war on drugs as somehow or another we need to attack other countries. We need to attack those who are addicted to drugs. We need to attack the borders where drugs are coming over. And when I think about that language that we used and our success in the war on drugs, we all know, we've all seen the statistics, that that's not a war that we won in terms of how we approach it. And in fact, as I travel to communities all across the country today, like the ones in Eastern Kentucky where we're working, or in other places, they're battling an opioid and meth crisis, the likes of which we haven't seen before. So the war on drugs has not been a good metaphor, a good way to talk about what we need to do to actually fight drug addiction in our country. There's been the war on terror, which we have been fighting since 9/11 and have pumped billions and billions of dollars and lost thousands of soldiers fighting. And this war on terror hasn't yielded the results that so many of us have wanted to see. And the language hasn't yielded the kind of responses that give us a sense of hope that we can actually take on terrorism in our world and create safer communities and a safer country. As you feel the stress, which I know that so many of you feel, because I've been talking to so many folks over the last handful of weeks, as you feel the stress of coordinating local efforts around COVID-19, as you feel the stress of keeping your organization afloat, as you feel the stress of caring for family members and worrying about what's going to happen to your neighbors and other loved ones, it seems to me that it's a mistake for us to adopt wartime language, when in fact what we need now more than ever is a human response to this global pandemic that we're facing, not only globally, but in our communities and in our daily lives, on our streets, in our neighborhoods, in our among our children, and that we need a human response. You know, a wartime response, when you think about it, just think about this for a minute. It quietly, maybe not even so quietly, gives us permission to think in certain ways, to think about others as the enemies, and therefore we turn inward away from them, when in fact, we don't have enemies. We have a public health crisis where more and more we need to turn outward toward one another, not turn away from one another, not turn our backs on one another. A wartime approach, a wartime response, a wartime metaphor, wartime language leads to exaggerated nationalism, where we demonize other countries and pump up our own country, and where we build walls around the United States, when in fact, we need to tear down the silos and the walls that exist between and among countries and figure out how we can fight this pandemic together. This pandemic knows no boundaries. It knows no ethnicities. It doesn't know the color of our skin, doesn't know our faith or heritage. It travels across all those things, and we need each other. A wartime mentality, a wartime approach takes us farther and farther away of thinking about ourselves as working together to fight this. We talk about the casualties of this pandemic. And honestly, as I watch every night and see the numbers up on the television screen, it reminds me of when I was a kid watching Walter Cronkite on CBS News or Roger Mudd on NBC News or Harry Reasoner on ABC News talk about the casualties from Vietnam. They were numbers. They were numbers that numbed us to what was actually happening thousands and thousands of miles away from us, as if it was an alternate reality, an alternate universe that had little to do with us. And I remember when I first felt that those numbers were pierced, when the son of Mr. and Mrs. Nichols, who lived across the street from where I grew up in upstate New York, who owned the local garage that was across from my home where I grew up, where my parents took our car to get fixed when it broke down. Their son was in Vietnam, and they lost their son in that war. And it was then that those casualty numbers started to feel more human to me, started to matter more. This isn't a distant war that we're fighting that has casualties. This is a public health crisis that involves human beings, that involves people, that frankly involves each of us. In wartime, we respond with fear, we retreat, we hunker down, we cover ourselves, we take cover. Sometimes we cower in the corner. That's not what we need right now. That's not what we need. We need to come out from our places. Maybe we still need physical distancing, but we need to be in this together. We need a human response. And the reason why this is so important to me, and why I hope it's important to you, and why I think it's important to our country, is that language really does matter. How we talk about things is how we think about things, how we engage with things. And I think right now, as a country, amid the chaos and this pandemic, we have an opportunity to express who we are and who we seek to become moving forward. That instead of hunkering down and cowering and turning away from one another, we need to come together and figure out who we are as a nation and as a people, and who we want to become moving forward. Now, just quickly, I know this dilemma firsthand. As some of you know, as a child, I was diagnosed with cystic fibrosis in the early 1960s. That was a surefire death sentence. I had an army of doctors and nurses and specialists who worked on me. I had that army. And in those years, that army felt cold and distant, and I felt invisible to them, never seen nor heard. I was an object in their vision to be acted upon. I experienced triage rooms where people asked me questions over and over and over again as if we were in a war. And those questions never hit on the things that really mattered to me, or surfaced or allowed me to talk about the pain and suffering that I was experiencing or the loneliness that I was experiencing. Instead, I was just processed as if I was an object to be processed, much like in a war. I didn't need soldiers to act on me. I didn't need the weapons of medicine to act upon me. I didn't need for them to think of my illness as an enemy that we needed to declare victory over, as if, again, I was an object to be acted upon. I needed someone to care for me. I needed for someone to reach out to me. I needed for someone to see me as a human being. I needed someone to listen to me. I needed a safe space to exist within. I needed people rallying around me to help support me. And ultimately, I found those people, three men in my community, who each separately and independently from one another lifted me up and made sure I didn't fall through the cracks. You know why? Because they didn't see it as a war that needed to be fought. They saw me as someone who required a human response to ensure that I could be lifted up and that I could succeed moving forward. And when I look back now, I know that they helped save me. So here's what we can do. Here's what you can do, what each of us can do. Because I think right now we face a fundamental choice in our country about who we want to be and who we want to become. And to make a choice, to make an affirmative choice, to reflect the best in us and the best of us, to fight for what we're for, not simply a war that we're against, then I think we need a human, not a wartime response to this pandemic that we're facing. And so here are 3 steps I think we need to take and that I think each of us needs to be thinking about. The first one is this. I think we need a humane response to this pandemic. As I said, in war, we talk about soldiers, we talk about weaponry, we talk about logistics. We see the other as the enemy. We talk about COVID-19 using all of these words and these images. We even call, think about this, we even call our medical professionals now our frontline soldiers in this war, as if they're wearing helmets to fight off bullets. But we need a humane response, a response that's rooted in compassion, a response that's rooted in kindness, a response that's rooted in caring for one another. Isn't this what our doctors and nurses and EMS professionals do every day when they exhibit this incredible dedication where they go back into the hospitals amid the dangers that they face. They go back into clinics amid the dangers that they face. The EMS workers go to people's homes and pick them up and transport them to hospitals amid the dangers that they as individuals face. Isn't this what they do every day, even though they don't have the protective personal equipment that they need to protect themselves amid this pandemic that we face? They're seeking to help people. They're seeking to be with people. They don't see these individuals as the enemy. They don't see their medical apparatus as weapons to use to act upon people, but rather to save people, to support people, to help ventilate people, to help them breathe, to help them stay alive. The more we have a wartime response, the more we use wartime language, the more we embrace and adopt a wartime metaphor, the more we hunker down, the easier it is to step away, to opt out, to make physical distancing social distancing, and to fall prey to hearing the messages that are all around us on the news and from our politicians. Instead, we must stay vigilant in seeing and hearing one another, in making each other visible, in exhibiting human kindness and compassion and care for one another. This is an epidemic about people, not war, and we need to keep our focus on a humane response. So if the first point is we need to focus on a humane response, the second step we need to take is that we need to mobilize human actions against this pandemic. In a pandemic, there is no question that we need government action. And we need, I would argue, more federal government action than we've seen. We need FEMA more now than ever. We need the Centers for Disease Control. We need the National Institutes for Health. We need corporations building supplies so that we have ventilators and protective wear that doctors and nurses can have, and EMS workers. We need even the military to run logistics and make sure that we're distributing these supplies efficiently and effectively across the country. But here's the thing about the notion of mobilization in a wartime effort. It makes us feel like we're being invaded. It makes us feel like we're losing control over our own country. It can make us feel as though we have less ownership over what's happening around us, that it's been subcontracted out to someone else. It can make us feel as though we have lost our sense of agency, our ability to shape the events around us, the ability to tap into our innate capabilities, the ability to exhibit our intrinsic goodness and humaneness towards one another. We Americans in this pandemic need to mobilize ourselves to respond to it. We can't just have government institutions. They are necessary, but not sufficient. And we need to mobilize both because it's an effective response, but also because it demonstrates that we have the capability, the know-how, the wisdom, and the will, and the courage to step forward and take ownership of our future and to shape the kind of country and communities that we want to build together that reflect the best in us and the best of us. And one of the most inspiring things that's happening right now is that we're seeing so many of these actions spring up naturally in communities. Networks of people reaching out to seniors to make sure that they're not lonely and shut in. People ensuring that people have access to groceries and can get their prescription drugs. Networks of parents coming together to make sure their kids are learning in school online now because they can't go to schools that have been shut down. There are all sorts of things that I've mentioned before, of restaurants banding together to make meals, and then networks of volunteers coming together and picking those meals up and delivering them to people. No one's organizing these things. They're starting to happen and spring up all across our country. And they're demonstrating to us our goodness, our humanity, our ability to come together and get things done, our belief that we have the ability to shape our common and shared future. And so, if the first point is that we need to focus on a humane response, and the second point is that we need to mobilize human actions to demonstrate our capabilities and to contribute to moving our country and communities and lives forward. The third point is this: we need to embrace our shared humanity. We need to embrace our shared humanity. You know, wartime talk, when we're not careful, reduces everything to good versus evil. It's simplistic, and we can become numbed by it. And in becoming numb by it, we close ourselves off to one another and sometimes even to ourselves. We just hunker down. And when this happens, I know this, so many of you feel this way. When this happens, it can make us feel alone. It can make us feel that we're on our own. But here's the thing: we're not alone. You're not alone. We're in this together. Think about this example that I love watching over and over again on videos, and that we see sometimes increasingly on the nightly news. In a place like New York City and in other communities, people are going out to their balconies, to their front porches, they're lining streets. And at a certain time each night, they're applauding the workers who are on their way to hospitals and clinics and other places. They're going to hospitals, and as people come into those hospitals for their next shift, or people come out of those hospitals to leave their shift, there are firefighters and police officers and other folks who are coming around and applauding, clapping together. Now, you may think that just applauding is a kind of simplistic act that doesn't hold much meaning. But in clapping together, we are creating something that none of us could have created on our own. We are doing something in unison that none of us could have done simply on our own. We are demonstrating through our action and the noise that we are creating that we are more than just ourselves alone, that we are together, that we represent something together. I think that we're actually expressing something that is intrinsically shared that could only be created by being shared and being created together. It is, in a very simple but profound way, when people come out from their homes together, when they see and hear one another, when we are visible to one another, when we are creating noise, which actually is music to our ears in the clapping sound of applause, we are expressing our shared humanity together. We face a fundamental choice right now in our country about how we talk about what's happening. And as you know, how we talk about things drives how we imagine things about what's possible and how we act on things. It shapes who we think we are and who we think we can become. There are these 3 steps. I think we don't need a wartime response in America today. We need a human response. We need to focus on a response that is humane. We need to focus on mobilizing human actions, and we need to embrace our shared humanity. So here's my hope for you today. My hope, as always, is that you take good care of yourself, your family, your loved ones, and that you stay in good health and good spirits. And in doing so, that you don't reflexively turn inward toward yourself and just the ones you love, but you turn outward toward the rest of us. And in doing so, when you turn outward, today I am asking you, I am urging you, I am imploring you to not adopt a wartime response, but to help us together adopt a human response to this pandemic that we're facing. Send me your thoughts on other topics you think I should cover in the coming weeks. I'm interested in knowing about them. I take them seriously. They help me shape these Facebook Lives. Go to our Facebook page and find the other episodes, the earlier episodes. If this episode itself spoke to you, I ask you to share it with others so that they can listen to it and think about it and turn outward and embrace a human response to the pandemic that we face. And also, as many of you know, this past Friday, we released a new podcast that I appeared on, How Do We Fix It? You can get it on your favorite platforms where you get your favorite podcasts. And I urge you to listen to that as well. Until next week, I'll be back next Wednesday, 4 p.m. Eastern Time, on another topic of turning outward together so that we can ground ourselves and stay grounded in these challenging times. Be well, stay healthy, and stay in good spirits. Thanks so much for joining me.